Vertigo is a symptom of a disordered system of balance. It is strictly defined as a hallucination of movement. Patients do struggle to describe their symptoms very precisely, and they present to me with symptoms that they describe ranging from dizziness, lightheadedness, problems with coordination, movement, and occasionally a patient will present following a fall. One of the important things I need to do as a treating doctor is to work out from the patient's symptoms precisely what they're describing and which body part that's likely to be associated with. Vertigo can be a symptom of disease in many different parts of the body. I most commonly deal with inner ear disorders, and vertigo is a characteristic feature of diseases of the inner ear. But in addition, these symptoms of balance disturbance and vertigo can also arise from diseases of the brain and conditions that affect our ability to maintain our position in space. Any impairment of vision can result in poor balance, and any conditions affecting our limbs and our mobility, such as arthritis or peripheral neuropathy, can also result in difficulties with balance and give rise to symptoms of vertigo.
Loss of vision or blind spots, at times followed by a headache. These are symptoms of dizziness. It is generally accompanied by a slow or irregular pulse, feeling of lightheadedness, pain in the eye, and ringing ears.
My particular interest is in managing patients with inner ear causes for their vertigo. By far the commonest cause that I come across is a condition called benign positional vertigo. This condition results from degeneration in the inner ear, causing free-floating particles to be symptomatic within the balance canals. This condition can be very effectively treated by repositioning maneuvers, and patients typically require just 1 or 2 treatments, with the vast majority following this having complete resolution of their symptoms. The next most common condition that I would treat would be Meniere's disease. This results in hearing loss, balance disturbance, fullness in the ear, and tinnitus. The vertigo can be effectively controlled by medical treatments, injections, and occasionally surgical procedures on the ear. Finally, I see many patients who've lost inner ear function, either as a result of trauma or viral infection. Typically, these patients will present with an initial acute vertigo and then a more chronic balance disturbance. My management of these patients is to use vestibular rehabilitation therapy, which is a form of exercise treatment which can be extremely effective but may take many months before a significant or complete recovery is achieved.
Provide you with some simple remedies that you can try at home. Take some water in a bowl and soak 1 teaspoon of coriander seeds into the water and 1 teaspoon of Indian gooseberry, which is also known as amla. Mix it and leave this aside overnight. Strain it and drink this on an empty stomach next morning. To improve its taste, you can even add a little sugar or honey to it. Repeat this for a few days. And another remedy, where you put 3 to 4 basil leaves in a cup of milk and boil it. Inhale the smell and take the tonic before going to bed.
On your heels, slowly move on to a table. Exhale and lower the hips to the heels and forehead on the floor. Have the knees together, or if you're more comfortable, spread the knees slightly apart. The arms can be overhead with your palms on the floor. Palms or fists can be stacked under the forehead. Or arms can be alongside the body with palms up.